For many older adults, a good night's sleep becomes harder to come by with age. Whether it's waking up too early, tossing and turning for hours, or feeling wide awake at 2 a.m., insomnia is a common and frustrating part of aging. In fact, nearly half of all people over the age of 65 report some kind of sleep difficulty. It's no wonder that many turn to sleeping pills, whether prescription medications, over-the-counter remedies, or natural supplements, hoping for relief. But here's the reality most people don't hear. Sleeping pills can carry real risks for seniors, especially when they're used incorrectly. While these medications may seem like a simple solution to a restless night, they can also increase the risk of falls, confusion, memory loss, and next-day grogginess that lingers far longer than expected. And if combined with other medications, or taken in the wrong way, they can quietly become more harmful than helpful. What makes sleep medication particularly tricky for older adults is how the body changes with age. Liver and kidney functions slow down, meaning drugs stay in the system longer. Sensitivity to sedatives increases, even at low doses. And when seniors are already managing other medications, the risk of interactions rises sharply. What might be a mild sleep aid for someone younger could be dangerously strong for someone in their 70s or 80s. In today's video, we'll explore 6 common sleeping pill mistakes that seniors must avoid. These are the kinds of errors that doctors, pharmacists, and caregivers see all the time. Errors that can quietly lead to more sleepless nights, not fewer. We'll break down each one in simple terms, explain the real-life risks behind them, and show you how to sleep more safely, whether you're using medication or looking for gentler, long-term alternatives. If you or someone you care for is using sleep medication or considering it, this video will help you make informed decisions, avoid unnecessary harm, and support better, more restorative sleep with clarity and confidence. Let's begin with mistake number 1, a decision that's often made out of desperation, but can cause more disruption than relief. Mistake number 1, taking sleeping pills too frequently or relying on them night after night. When sleep becomes elusive, especially for several nights in a row, it's understandable that many older adults turn to sleeping pills as a quick fix. At first, it might feel like a miracle. One tablet, and finally, the body rests. But for many seniors, this sense of relief quickly becomes a nightly routine. And before long, taking a sleep aid shifts from occasional help to something that feels absolutely necessary to fall asleep at all. This is where the first and most common mistake begins: using sleeping pills too frequently or relying on them every single night. What many people don't realize is that most sleep medications, especially prescription sedative hypnotics like zolpidem, Ambien, esalpiclone, Lunesta, or even over-the-counter antihistamines like diphenhydramine, Benadryl, are not meant for long-term use. These medications can be helpful when used occasionally and in the right context, such as during short-term stress, jet lag, or temporary disruptions. But when used night after night, they can lose effectiveness, leading to tolerance. That means the same dose that once worked no longer brings the same result, which may prompt some to take more, take them earlier, or combine them with other substances like alcohol, all of which increase the risk of harm. The problem is particularly concerning for seniors because the older body processes drugs more slowly, which causes these medications to linger into the next day. This can lead to morning grogginess, impaired thinking, slower reflexes, and a higher likelihood of falls. In fact, regular use of sleep medications has been linked to increased fall risk, hip fractures, and even hospitalization in older adults. These risks grow higher when the medications are used daily over long periods, especially without supervision. Take the case of George Wallace, a 78-year-old widower from Tempe, Arizona. After his wife passed away, George struggled with sleep and began taking a prescription sleep aid nightly. At first it helped, But after a few weeks, he found himself waking up more groggy than refreshed. He started having trouble remembering simple details, and one morning, he tripped while walking down his porch steps. At the hospital, a nurse explained that the lingering effects of his nightly sleeping pills likely impaired his balance and reaction time, putting him at greater risk than he realized. Even when side effects aren't dramatic, relying on sleep medication every night can mask the deeper issue. Whether it's chronic insomnia, anxiety, depression, or simply poor sleep habits. And because the brain adapts to medication, stopping suddenly after long-term use can cause rebound insomnia, where sleep becomes even more disrupted than before. Instead of reaching for sleep medication every night, it's often more effective and safer to explore lifestyle-based approaches that improve sleep from the inside out. That might include cognitive behavioral therapy for insomnia, CBTI, adjusting light exposure during the day, setting consistent sleep and wake times, and identifying any underlying medical or emotional causes of sleep disturbance. These strategies take more time, but offer lasting results without the long-term risks of drug dependency. In summary, taking sleeping pills too frequently is one of the easiest mistakes to make, and one of the most dangerous for seniors. What starts as occasional help can quickly turn into dependency, bringing with it grogginess, memory issues, fall risks, and rebound insomnia. If you use sleep medication, try to keep it as an occasional tool, not a nightly requirement, and always talk with your doctor about safer long-term strategies for improving your sleep naturally. Mistake number 2. Mixing sleeping pills with alcohol or other sedatives. For many seniors struggling with sleep, the temptation to take the edge off before bed can be strong. A warm glass of wine or a nightcap may seem harmless, maybe even helpful, especially when paired with a sleeping pill. After all, both are known to make you drowsy, so combining them might appear to be an effective way to get deeper rest. But in reality, mixing sleeping pills with alcohol is one of the most dangerous and potentially life-threatening mistakes an older adult can make, especially when done unknowingly or without medical guidance. Both alcohol and most sleep medications are central nervous system depressants, which means they work by slowing down brain activity. On their own, they can reduce anxiety, relax muscles, and cause drowsiness. But when taken together, these effects can become dangerously amplified, leading to slowed breathing, irregular heart rhythm, dangerously low blood pressure, and even a loss of consciousness. For older adults, whose bodies metabolize substances more slowly and whose organs are often more sensitive, this interaction can be especially toxic. The risk is even higher for those taking benzodiazepines such as temazepam or lorazepam, or newer Z drugs like zolpidem, Ambien, and isoprolol Lunesta. These medications already carry strong sedative effects on their own. Adding alcohol to the mix increases the chance of next-day confusion, impaired coordination, memory problems, and falls, all of which can have devastating consequences for someone in their 70s or 80s. Take the case of Eleanor Briggs, an 81-year-old from Tacoma, Washington. Eleanor had recently started taking a sleeping pill prescribed by her doctor. One evening, she poured herself a small glass of wine before bed, as she'd done for decades, not realizing how different it would be now that she was on sleep medication. That night, she woke up disoriented, tried to walk to the bathroom, lost her balance, and fell, breaking her wrist. Her doctor later explained that the combination of the sedative and alcohol had impaired her reflexes and balance, far more than either would have alone. What makes this mistake more dangerous is that it often feels mild or uneventful at first. Many seniors have a drink with dinner and don't feel any different. But once a sleep aid enters the system, the cumulative sedative effect increases dramatically, sometimes without warning. Because older adults tend to sleep more lightly and wake more frequently, The disorientation caused by even low-dose combinations can lead to bathroom falls, confusion, and poor decision-making in the middle of the night. And it's not just alcohol. Other substances, like over-the-counter antihistamines, some painkillers, or certain anxiety medications, can interact with sleeping pills in similar ways. These combinations often aren't obvious, especially when multiple doctors are involved, or when supplements are added without full disclosure. Seniors who take melatonin or herbal sleep aids might assume they're safer, but even these can have interactions, especially in higher doses or when combined with other medications that affect the nervous system. The safest approach is to treat all sedatives, including alcohol, as serious agents that require professional oversight when used alongside sleeping medication. Talk with your healthcare provider about everything you take, whether prescribed or over-the-counter, and be especially clear about your alcohol intake, even if it's occasional. In many cases, doctors can suggest alternatives that won't create these dangerous interactions or help you taper off medications that carry greater risk when combined. In summary, mixing sleeping pills with alcohol or other sedatives is never safe for seniors, no matter how small the dose or how harmless it seems. What starts as a simple routine can quickly become a medical emergency. With better awareness, clear communication, and careful planning, you can protect your sleep and your safety without putting your health at unnecessary risk. Mistake number 3: taking sleeping pills at the wrong time. In the search for better sleep, timing is everything. And one of the most common mistakes seniors make with sleep medication is taking it at the wrong time. Too early, too late, or without regard for the body's natural rhythm. Unlike painkillers or cold medicine, sleeping pills are not effective the moment you take them, nor should they be taken hours before bed. Timing affects not only how well the medication works, but also how it affects your safety and how rested or groggy you feel the next day. Most prescription and over-the-counter sleep aids are designed to take effect within a specific window of time. For example, medications like zolpidem, Ambien, ezulopiclone, Lunesta, or diphenhydramine, found in some OTC sleep aids, typically start working within 15 to 45 minutes. If taken too early, say while still watching TV, reading in the living room, or having a late snack, the sedative effects can start setting in before you're safely in bed. This increases the risk of falling, losing balance, or becoming confused as the medication takes hold in the wrong setting. On the other hand, taking sleeping pills too late, perhaps after tossing and turning for hours, can cause the medication to remain in your system well into the next morning. For older adults whose metabolism is slower, this means daytime drowsiness, impaired focus, reduced coordination, and a higher likelihood of falls or car accidents if driving early the next day. In fact, many seniors report that they feel even groggier the day after taking a sleep aid than they did after a bad night's sleep without one. Consider the story of Richard Lowry, a 77-year-old from Portland, Oregon. Richard often delayed taking his sleeping pill, hoping he might fall asleep naturally. But when he couldn't, he'd eventually take it around 1 or 2 a.m. The next day, he found himself feeling foggy, well into the afternoon. At one point, he nearly tripped over his own dog leash while walking down his porch steps. When he brought this up with his doctor, it became clear that the timing of his pill was leaving him under the influence long after sunrise, especially given how slowly his body processed the medication. There's also a group of people who take their sleeping pills too early, hoping it will kick in by the time they get to bed. But taking the medication and then staying up for an hour or more can lead to something called anterograde amnesia, where you forget what you were doing or saying in that time between taking the pill and falling asleep. This disorientation is unsettling, and for seniors it can be mistaken for early signs of dementia or cognitive decline, when in fact it's just poor timing with the sleep aid. To get the most benefit with the least risk, sleeping pills should be taken only when you're truly ready for sleep. That means the lights are off, the house is quiet, and you're in bed, or just moments from getting into it. Your brain and body should already be winding down. The medication is then supporting a natural transition to sleep, not forcing it while your body is still active or stimulated. In summary, taking sleeping pills at the wrong time can reduce their effectiveness, prolong their impact into the next day, and increase the risk of dangerous side effects, especially in seniors. Proper timing isn't just about convenience. It's a key part of staying safe and getting the restful, restorative sleep your body needs. By syncing your sleep habits and medication use more carefully, you give yourself the best chance of waking up refreshed, alert, and steady on your feet. Mistake number 4. Taking the wrong kind of sleeping pill for your specific needs. Not all sleeping pills are created equal, and for seniors, choosing the wrong kind of sleep aid can quietly do more harm than good. Whether it's using an over-the-counter antihistamine that causes daytime confusion, or being prescribed a long-acting sedative when you only have trouble falling asleep, taking the wrong type of sleeping medication is a mistake that can quietly disrupt your nights and your days. The body's chemistry changes with age. Seniors often have slower metabolism, reduced kidney and liver function, and increased sensitivity to medications. That means a drug that's safe and effective for a younger adult may become problematic later in life. Unfortunately, many older adults continue using sleep aids that were prescribed years earlier, or worse, select an over-the-counter option on their own without fully understanding its risks. One of the most common examples is diphenhydramine, an ingredient found in popular sleep aids like Tylenol PM or Advil PM. While it may help you fall asleep, diphenhydramine is also an anticholinergic, which means it affects a chemical in the brain that helps with memory, learning, and focus. In older adults, these drugs have been linked to daytime grogginess, memory lapses, increased risk of falls, and even worsening confusion or delirium, especially when used regularly. For people already living with mild cognitive decline or balance issues, these effects can be serious. Prescription sleep medications also vary widely in how they work. Some are meant to help you fall asleep quickly, others are designed to help you stay asleep throughout the night. Using the wrong one for your sleep problem can backfire. For instance, if you wake up frequently during the night, but take a short-acting pill that only lasts an hour or two, you might fall asleep, but still wake up at 2 a.m., feeling just as frustrated. On the other hand, if you take a long-acting pill but only have trouble falling asleep, not staying asleep, it could linger into the morning and make you feel sluggish, foggy, or off balance for hours. Let's consider the experience of Melinda Porter, a 79-year-old from Tampa, Florida. Melinda was prescribed a sedative several years ago when she was going through a stressful period. She continued using it as a nightly sleep aid, despite no longer needing it for anxiety. The medication was a long-acting benzodiazepine that stayed in her system well into the next day. Over time, Melinda noticed her balance was worsening. She was forgetting things more often, and she felt foggy most mornings. When she finally discussed it with her geriatrician, the doctor explained that her sleep medication was no longer appropriate for her age and likely contributing to her daytime struggles. With her physician's help, she transitioned to a safer alternative and added non-drug strategies for sleep, which made a significant difference in her energy and clarity. Choosing the right sleep aid requires a thoughtful conversation between you and your doctor. It should be based on your specific sleep pattern, your other medications, your daily routine, and your overall health. What works for one person may not work for another, and what worked 10 years ago may not be safe or effective today. This is particularly important if you're taking other drugs that affect the nervous system, or if you've had falls, confusion, or memory issues in the past. In summary, taking the wrong type of sleeping pill, whether prescription or over-the-counter, can create a cycle of poor sleep, grogginess, and health risks that go unnoticed until something serious happens. With age, your sleep needs change, and your medication strategy should change with them. Working with your provider to choose the right tool for your specific situation is not only safer, it's far more effective in the long run. Mistake number 5. Stopping sleeping pills abruptly without medical supervision. After using sleeping pills for weeks, months, or even years, some seniors reach a point where they want to stop. Maybe the side effects have become too noticeable. Maybe they've read that sleep aids aren't safe long-term. Or perhaps they feel ready to try sleeping naturally again. Whatever the reason, this decision is often made with the right intentions. But if carried out without guidance, stopping sleeping pills abruptly can backfire and lead to serious consequences, both physically and emotionally. Many sleep medications, especially prescription ones like zolpidem, Ambien, temazepam, or other benzodiazepines, act directly on the brain's chemistry. These drugs calm activity in the nervous system, helping you feel relaxed and ready for sleep. But over time, the brain can grow used to this external calming force. If you suddenly take it away, the brain may react with overstimulation, leading to rebound insomnia, anxiety, restlessness, irritability, or even confusion. For seniors, whose bodies are more sensitive to abrupt chemical shifts, these symptoms can feel overwhelming and disorienting. One common myth is that if you've only been taking a small dose, it's safe to stop cold turkey. But that's not always true. Even low-dose sleep aids can cause withdrawal symptoms or a return of sleeplessness that's worse than before. In fact, many older adults who try to stop sleeping pills on their own find themselves back in a cycle of frustration, increased nighttime awakenings, and heightened dependence, all because they didn't taper gradually. Take the story of Geraldine Moore, an 84-year-old from Denver, Colorado. Geraldine had been using a sleep aid for almost a year to help with post-surgical stress. As her health improved, she felt ready to stop taking it, but she did so abruptly, thinking the habit would end quickly. Within days, she was wide awake until morning, anxious for no reason and unsure what was happening to her body. Her doctor later explained that her brain had adapted to the nightly sedative and needed time to adjust. With her physician's help, she transitioned to a slow taper over several weeks, supported by changes in her bedtime routine, light exposure, and stress management strategies. Only then did her sleep begin to recover naturally. Another risk of stopping suddenly is underestimating how long the body takes to regain balance. Seniors may expect to sleep well right away without the medication, and when they don't, they become discouraged. This disappointment can lead them to resume the medication, even increasing the dose out of desperation, which only deepens the cycle. The key to success lies not in stopping quickly, but in stopping thoughtfully. Tapering off sleep medication involves gradually lowering the dose under a doctor's supervision. It often includes identifying and treating the root causes of insomnia, which might involve chronic pain, anxiety, poor sleep habits, or irregular daily routines. Cognitive behavioral therapy for insomnia, CBTI, has shown to be especially effective for seniors and is now considered the gold standard for long-term sleep improvement without drugs. But CBTI works best when medication is reduced slowly and safely, not abruptly. In summary, stopping sleeping pills without medical guidance is a mistake that can worsen sleep, trigger emotional distress, and increase dependence rather than resolve it. For seniors hoping to regain natural, restorative rest, the path forward requires patience, support, and a gradual, personalized plan. When done right, getting off sleep medication can be a turning point toward better nights, clearer mornings, and more confident days. Mistake number 6. ignoring the underlying causes of insomnia and treating only the symptoms. When sleep becomes elusive night after night, it's natural to focus on immediate relief. For many seniors, that means reaching for a sleeping pill, assuming the problem lies solely in the ability to fall or stay asleep. But one of the most common and overlooked mistakes is treating insomnia as an isolated issue, without asking what's actually causing it. Because the truth is, in older adults, sleep difficulties rarely happen in a vacuum. They're often symptoms of something deeper, something that no pill can truly resolve. Chronic insomnia in seniors is frequently linked to other physical or emotional conditions. Pain from arthritis, neuropathy, or an old injury can make it hard to get comfortable. Gastrointestinal discomfort, frequent urination due to prostate issues or overactive bladder, or breathing problems like sleep apnea may lead to frequent awakenings. Emotional health also plays a large role. Anxiety about health, grief after the loss of a loved one, financial worries, or feelings of loneliness can all silently contribute to poor sleep. In fact, studies show that depression and anxiety are two of the most common causes of persistent insomnia in seniors, yet they often go undiagnosed and untreated. Using a sleeping pill in these situations may temporarily knock you out, but it does little to address the true source of the problem. It's like painting over a leaky ceiling without fixing the pipe above it. Eventually, the leak returns, and often worse than before. Worse still, the longer you rely on medication without addressing the root cause, the more difficult it can become to unravel the cycle. Take the experience of Barbara Chen, a 75-year-old from Eugene, Oregon. Barbara had been waking up every night around 3 a.m. for nearly a year. Her doctor prescribed a sleep aid, which helped her sleep more soundly, but she still woke up feeling tired and unsettled. After finally undergoing a full evaluation, it was discovered that Barbara had undiagnosed sleep apnea, a condition causing her to wake frequently without realizing it. Treating the apnea, rather than just masking the symptoms, made a tremendous difference in her energy, mood, and overall health. She was eventually able to reduce and then stop her use of sleep aids altogether. In other cases, the culprit may be psychological. A senior dealing with prolonged grief, loneliness, or fear about health changes may not even recognize these feelings as contributors to their insomnia. But the brain stays alert when it feels emotionally unsettled, even at night. In such cases, talk therapy, support groups, or structured cognitive behavioral therapy can be more effective than any pill. These approaches provide relief that is not only deeper, but more sustainable. Failing to investigate the true reason behind sleep disturbances often results in more medication, not better rest. And with every added pill comes increased risk of side effects, interactions, and dependency, especially for older adults who may already be managing multiple chronic conditions. In summary, ignoring the root causes of insomnia and treating only the surface symptoms with sleeping pills is a short-term solution to a long-term problem. The most restful, restorative sleep comes not from numbing the brain, but from calming the body, resolving hidden stressors, and addressing the physical or emotional triggers that keep sleep at bay. With the right support, medical insight, and lifestyle changes, seniors can experience meaningful improvement without leaning solely on medication. Sleep is not just about rest. It's a mirror reflecting our overall health. And when we treat its causes, not just its symptoms, we begin to heal far beyond the bedroom. For many seniors, the search for better sleep can feel like chasing something just out of reach, a peaceful night, free from tossing, waking, or watching the clock. In that pursuit, sleeping pills may seem like a practical answer, and in the short term, they sometimes are. But as we've explored today, using sleep aids without awareness or proper guidance can quietly lead to more harm than healing. From relying on pills every night to mixing them with alcohol, from taking them at the wrong time to using the wrong type for your needs, These common mistakes can slowly erode not just the quality of your sleep, but also your balance, memory, clarity, and confidence during the day. And stopping them abruptly or ignoring the root causes of your insomnia can make the journey even harder. The good news is that you don't have to choose between sleepless nights and risky medications. With the right support, clear information, and a willingness to look deeper, many seniors find that they can improve their sleep naturally by addressing what's truly behind the disruption. That might mean working with your doctor to treat sleep apnea, adjusting your evening routine, managing chronic pain more effectively, or seeking emotional support for grief or anxiety. These steps may not be instant fixes, but they build lasting change. Medication has its place, but it should be part of a larger conversation, not the only solution. And with age, that conversation becomes even more important. Your brain, your body, and your sleep deserve thoughtful care, not shortcuts. If you've recognized any of these mistakes in your own routine, don't be discouraged. You're not alone, and you're not stuck. Talk to your doctor, ask questions, take one small step at a time towards safer, more restorative rest. And if this video helped shed light on sleep struggles you or a loved one face, be sure to like, share, and subscribe to Active Healthcare, your trusted companion in aging well, sleeping better, and living fully. One peaceful night at a time.